future as a homeopathy or other system of medicine. So when we get graduation, we get some question marks. Is it possible life with homeopathy or without other system of medicine? The answer is, of course, we are graduated in the field of homeopathy. Of course, we have to run behind the homeopathy. And this is the answer, homeopathy. Next, the scope for homeopaths in dermatology. There is a huge scope in dermatology as there is an increase in the level of skin disease today. Almost everyone come across situation where they have a rash or an illness which needs medical attention. Now is when dermatologists will have more demand than ever before. Homeopathy in dermatology, because of recurring expenditure and side effect of the existing methods, it is less expensive, no recurrent expenditure, without any side effects. We have scope in the following areas: hair fall, alopecia, dandruff, tinea, vitiligo, warts, acne, keloids, psoriasis, chasma, etc. In the nail, brittle nail, deformed nail, discoloration of nails, cosmetic allergy and complexion. Dermatology. So why did I choose to present on this subject? So as many of you know, treating skin condition or disorder can be challenging. I believe they are significantly more difficult to treat without the aid of homeopathy. So for many years now in my practice, 10 years, I have focused on and researched the homeopathic treatment of skin conditions and have gathered numerous before and after pictures for various skin disorders among my own patients. I have recently felt to share my findings with my colleagues in hopes that they will benefit from this information. So, what is dermatology? This is a skin structure. So, dermatology is a branch of medicine dealing with the skin. It is a specialty with both medical and surgical aspects. A dermatologist is a specialist medical doctor who manages diseases related to skin, hair, nails and some cosmetic problems. So common skin diseases in everyday practice. So fungal infection, acne vulgaris, alopecia areata, psoriasis, vitiligo, urticaria, scars, chickenpox, hair fall, chloasma, melasma, boils, corns, warts, impetigo, keloids, lichen planus, dandruff, skin tags, etc. Let us see some photographs of the diseases. So, alopecia areata, so burns, warts, boils, keloids, psoriasis, fungal infection, boils on the scalp of the baby. Next, melasma or chloasma. Next, vitiligo. So corn. This is Pitheris alba or tinea versicolor. What is it actually? Fungal infection disease. So psoriasis in the 1 month old baby. Next. So scrotal genital scabies. So filariasis. So psoriasis. Plantar psoriasis and palmar psoriasis. This is acne vulgaris. These are the some skin conditions. Let us go deep of that each skin diseases. Let us start with the acne vulgaris. This is the case of acne vulgaris. So acne is also known as acne vulgaris. It is an inflammatory disorder of pilosebaceous follicles which usually occurs in adolescents of both sexes. It is a very common skin disorder which can present with inflammatory and non-inflammatory lesions. It is primarily affects skin with a relatively high number of glands, including the face, upper part of the chest and back. The resulting appearance can lead to lack of confidence, anxiety, reduced self-esteem, and in extreme cases, depression or thoughts of suicide. In 2015, acne affected approximately 633 million people globally, making it the 8th most common disease worldwide. Acne commonly occurs in adolescents and affects an estimated 80 to 90% of teenagers in the Western world. Children and adults may also be affected before and after puberty. Although acne becomes less common in adulthood, it persists in nearly half of affected people into their 20s and 30s, and a smaller group continues to have difficulties in their 40s. So this is a case of fungal infection. Can you see all the things? Fungal infection fungal is also known as mycosis, is a disease caused by fungi. Different types are traditionally divided according to the part of the body affected. Fungal infection have worldwide distribution and are common, affecting more than 1 billion people every year. It is very common skin condition, very contagious it is. So many patients, when you sit in the clinic or as you show to the society that I am a skin specialist, commonly whenever you open the clinic, the first patient will be fungal infection. This is a very common. Differential diagnosis, some tinea and candidiasis infection of the skin can appear, similar to eczema and lichen planus. Pityriasis versicolor can look like a seborrheic dermatitis. Pityriasis rosea, Pityriasis alba can look like a vitiligo. So before that I shown you the one baby sitting in the backside white patches, that is Pityriasis alba. So we may get confused with the fungal infection also. So we have to be very keen observer. So this is what. So on the face you can see the single wart is present. Warts are non-cancerous viral growth usually occurring on the hands and feet, but also affect other locations such as genital or face. One or many warts may appear. They are distinguished from cancerous tumors as they are caused by viral infections such as human papillomavirus rather than a cancerous growth. Warts are very common. The most people being are infected at some point in their lives. The estimated current rate of non-genital warts among the general population is 1 to 13%. They are more common among young people. The estimated rate of genital wart in sexually active women was 12%. Warts have been described at least as per back as 400 BC by Hippocrates. So it is a long history wart. Diagnosis on dermatoscopic examination, warts will commonly have finger-like or knob-like extension. So, chalazion or melasma, very common conditions when you sit in the OPD. Common, females are affected. So, melasma, also known as chalazion, is a tan or a dark skin relation. Melasma is thought out to be caused by sun exposure, genetic disposition, hormone changes, and skin irritation. Although it can affect anyone, it is particularly common in women. So, signs and symptoms. The symptoms of melasma are dark, irregular, well demarcated, hyperpigmented macules to patches. These patches often develop gradually. Over time, melasma does not cause any other symptoms beyond a cosmetic discoloration. Patches can vary in size from 0.5 cm larger than 10 cm depending on the person. Its location can be categorized as centrofacial, malar, and mandibular. The most common is centrofacial, in which patches appear on cheeks, nose, upper lip, forehead, and chin. So commonly we are seen on the chins and the nose. Commonly affected females are affected. Differential diagnosis.
melanoma should be differentiated from freckles, solar lentigo, toxic melanoma. Let us I will tell about the freckles and what is melasma, what is the freckles. Freckles, they are having the brown spots. So their gap will be more in the freckles. But melasma, it is a continuous discoloration, commonly on face. Okay. Also, cases of drug-induced pigmentation have been reported. Cases of drug-induced pigmentation. Drug-induced means when other system of medicine gives some medications, when they apply,